Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education.
The following podcast is supported by an educational grant from Acadia Pharmaceuticals.
Hi, I'm Dr. Jeffrey Newell, professor of pediatrics at Vanderbilt University Medical Center and director of the Vanderbilt Kennedy Center. Welcome today to this podcast series titled Bringing Focus to the Diagnosis and Management of Rett Syndrome. Today, joining me is Dr. Alan Percy, professor of pediatrics, neurology, neurobiology, genetics, and psychology, and the Sarah Catherine Bate Endowed Professorship for Rett Syndrome, Emeritus at the University of Alabama at Birmingham. Welcome, Alan. In this episode titled Signs and Symptoms of Rett Syndrome, a focus on early diagnosis, we're going to talk a little bit about what it is Rett Syndrome and how do you make that diagnosis. So let's get started. So Dr. Percy, could you tell us a little bit about what is Rett Syndrome?
Rett syndrome is a neurodevelopmental disorder that principally affects girls or women and is characterized by loss of hand skills and spoken language and problems or inability to walk, along with repetitive, non-functional hand movements, which are called stereotypies. Additionally, people with Rett have a significant number of other medical issues, including among these are difficulties with growth and nutrition, many of them requiring alternative feeding through a G-tube or gastrostomy tube, cognitive impairment, seizures, scoliosis, autonomic abnormalities, as well as many others. These individuals have lifelong impairment, which require that caregivers give them support 24 hours a day throughout their lives. Importantly, Rett syndrome is progressive, although it is not a neurodegenerative disorder. That is, there is no loss or death of neurons in the brain or elsewhere in the nervous system. Rather, it seems that neurons do not talk to each other in a proper way and don't make appropriate connections with other neurons. The majority of individuals with Rett syndrome have mutations in an X-linked gene on the long arm of the X chromosome, which is called methyl CpG binding protein, or shorthand is MECP2. And while the majority of individuals with this disorder are females, a smaller percentage of males may have mutations in the same gene, and some of them actually express the same features as girls or women with Rett syndrome, while others have very severe neurological issues.
Well, thank you for that. And so when you talk about Rett syndrome, when do these problems really come on? When do people notice that there's something going on with people with Rett syndrome?
Well, typically, the full spectrum of disorder, neurological issues that one sees in girls with Rett syndrome don't appear until the second year of life. That is when there is a regression of developmental skills and the onset of stereotypies. But clues early on in the life of these individuals may be apparent already by 1.5 or 2 months of age, with an abnormal deceleration in the rate of head growth, or during the first 6 months of life. These girls are too good. They eat, they sleep, they don't fuss a whole lot. Beyond that, in the next 6 months of life, there may be delays in the normal acquisition of developmental skills that would raise concerns. The primary features of Rett syndrome, however, are partial or complete loss of hand skills and speech or language, the delayed or absence of walking, and the presence of these hand stereotypies.
You said that the about 2 years is really 2 years old when real problems are, but there are things that are occurring before that regression and the loss of skills. In your experience, what kind of range do families start raising questions and concerns about their child's development that may ultimately lead to having Rett syndrome?
That's very interesting. So for a family who in whom the first child is a girl who's going to develop Rett syndrome, they may not have any previous experience with early development, and therefore don't recognize the early features that one might see in girls with Rett syndrome, such as being too good or having delays in development. Beyond that, it is many times other family members, such as a grandmother or an aunt or uncle, who say, boy, your daughter just isn't making the kinds of progress that I would expect for a child of this age.
This is before they come see a specialist, and presumably they also talk to their doctors, a pediatrician or primary care doctors. And is that enough to begin the process of evaluating if something's wrong often or not?
Well, it's really is determined by the index of suspicion that the primary care physician may have. They may regard this delay in development or this feature of being too good as just part of the range of normal development, and without specific features such as loss of skills, they may put off additional referrals or even evaluations on their own part until these other features arise. So it really depends on an index of suspicion and enough prodding by families and extended families to go further towards a specific diagnosis.
If you were to say for primary care doctors and pediatricians, and a family brings this up, is there any features that he brings up? Oh, my child's not quite keeping up with their skills. Is there anything that you'd recommend really bringing up the idea maybe this child has Rett to the primary care doctor to consider it before they regress?
Well, they could say to their primary care physician, I've been looking at the internet and I came across this unusual disorder of Rett syndrome, and there's just some features that my daughter demonstrates that maybe we ought to look further at this disorder. How could we do that?
Yeah, are there any other things that kind of make this diagnosis challenging? And anything that how you can overcome that?
Well, some of these symptoms of part of the regression or problems may be really subtle and could be non-specific, not related specifically to Rett syndrome, but to other disorders, such as Angelman syndrome or some other neurodegenerative conditions, or even children with autism spectrum disorder who could show features of indifference that might be seen in the young girl with Rett syndrome.
You also mentioned maybe there's some early things that maybe people don't pay attention that much to, like the rate that the head is growing.
Deceleration in the rate of head growth does not occur necessarily in all girls with Rett syndrome, or may not be evident in all girls. Early on, microcephaly, that is very abnormal head growth, was part of the diagnostic criteria. It soon became understood that this acceleration and the rate of head growth or the microcephaly was not seen in all girls with Rett syndrome. Many of them have head circumferences in the normal range.
So you're saying that it could be if people were being more attuned to that deceleration, even if it doesn't, it's still within the normal range, but it is a change from when they're young. That might be a clue that they need to think about Rett syndrome.
Absolutely.
Yeah.
Absolutely.
So you mentioned that the Rett syndrome is oftentimes associated with certain genetic abnormalities. How do you go about looking at that and understanding it?
Well, you could look at this in one or two or three different ways. If you have a child in whom you think that these diagnostic features are pretty clear, for example, there's been a period of regression, a loss of spoken language, a loss of hand skills, either delayed or absent walking, and then the onset of stereotypies, you could go directly for genetic test for MECP2. And that would be one answer. If you were missing some of these features, but you had general concerns about this, you could go for whole genome sequencing or some of the specialized panels that exist for children with either developmental delay or even epilepsy, although epilepsy before the age of 2 in girls with Rett syndrome is pretty unusual.
So you're saying, though, that like on those gene pan, obviously targeted just for the MECP2 mutation, but you could look at whole exome or whole genome sequence, just open-ended. But the gene panels, you're saying a lot of the ones that might be chosen for a child with developmental delay or epilepsy or something like that do include the MECP2 as something that gets evaluated.
That's correct. But if you just focused on the MECP2 gene for the sequencing analysis and the results came back as not abnormal, you still, if you were convinced that the child was meeting these features, there is an additional testing for large deletions, which would be missed by ordinary sequencing. And they represent up to 10% of all girls or women with Rett syndrome. So that would be an important second step to take if that was the line of diagnostic approach that you took.
And when somebody orders a genetic test like this, what is the best, how would you recommend how you interpret or understand these genetic results?
Yeah, I think it depends on who orders the test. If it is a geneticist or a child neurologist or a developmental pediatrician who is quite familiar with Rett syndrome and understands these testing methodologies and can look at the specific mutation, that person or persons could easily explain the information. If the test is ordered by someone who is less experienced, it may be important to involve a geneticist or a genetic counselor to educate the family about the meaning of the specific mutation and the next steps that they might consider. There are databases in existence, such as RettBase, which is funded by the International Rett Syndrome Foundation. And those databases can provide important information for the geneticist or genetic counselor or other physicians to help them understand the frequency with which the specific mutation may occur and what sorts of problems are associated with those specific mutations.
Thanks, that's very helpful. Well, is there any other comments or things you'd like to mention?
I think that it is very important that an individual with any developmental disorder, but particularly with individuals with Rett syndrome, that the family be given a clear understanding of the diagnosis and what is needed, and that these individuals gain referral to a center, and there are many around the country in which there is a definite expertise in Rett syndrome with the associated subspecialists that those individuals need to see. And importantly, the associative therapies, physical, occupational, speech and language therapies, need to be initiated as soon as possible. This is not something that is necessarily going to produce remarkable improvement, but is going to at least delay any further changes and maintain their level of function as long as possible.
Great. Thank you for that. Well, I think the key takeaways from this is that Rett syndrome is a severe neurodevelopmental disorder that's characterized by a relatively normal period of initial development with some developmental delays that can be kind of subtle, followed by regression, specifically spoken language and hand skills, with development of these meaningless repetitive hand movements called stereotypies, and difficulty or the inability to walk. Most of the people who are affected are girls, but there are some boys, and most of the people have mutations in this MECP2 gene, MECP2. The challenge of the diagnosis clearly is the early, prior to regression, around 2 years. The symptoms may be present, but relatively subtle and non-specific, and may make it difficult to actually make that early diagnosis. But with careful attention to some of the details that you outlined, it should be an issue that should come into people's minds when they have a child who is not making skills, and maybe more likely to be a girl, and maybe with careful analysis of the head growth, you might see subtle abnormalities. Alan, I'd really like to thank you for this great discussion. I think it was really informative. And I'd like to thank everyone who's participating, and I hope you found this to be valuable. And please continue on to answer the questions that follow and complete the evaluation.